So it looks like we're ready, everybody. Thank you so much for being with us on this Wednesday. We appreciate you being here. This is the news conference for April 15th from the Unified Command here at Maricopa County. My name is Fields Mosley, Fields Mosley, and I am the lead PIO under this Unified Command as well as the Communications Director for Maricopa County. Today's topic is going to be about the latest data more broadly here for Maricopa County, as well as the hospitalization epicurve and what this means for Maricopa County and how we're seeing the disease spread in our county. Dr. Rebecca Sonnenschein, she is our Public Health Medical Director, also an infectious disease specialist, who will make a brief presentation and then be available for questions. We also have Marcy Flanagan. She is our Director of Maricopa County Public Health. And we also have Robert Rowley, the Director of Emergency Management, who is the co-leader over the Unified Command here in this structure. So if you've been a part of our press conferences in the past, you kind of know the rules of the road. I'll go ahead and go through them briefly. Members of the media, you will be called on by one of our moderators who is in the webinar with you. You can virtually raise your hand in that webinar. He will call on you, open up your microphone. Please make sure your mic is unmuted at that time so you can ask your question. Please only ask one question at a time. We'll come back around to you. We've had several times where we've been able to come back and hear from people multiple times and have all your questions answered. If we're unable to answer your question today, we will do our best out of the Joint Information Center to take down your question and get back to you. And you're always welcome to email us as well. So with that, I would like to have Dr. Rebecca Sonnenschein come up and start her short presentation.
Good afternoon. I'm Dr. Rebecca Sonnenschein. That's Sunenshine. We're up to 2,145 cases in Maricopa County of COVID-19, with about 1 in 5 being hospitalized for their illness and 6% requiring care in the intensive care unit at some point during their illness. 60 people tragically have lost their lives from COVID-19, which is about 3% of the total number of people who have been diagnosed. Remember, these cases only represent patients who are sick enough to get tested for COVID-19 and don't include the many cases with mild illness or those with no symptoms at all who haven't gotten tested for COVID-19. So I want to show you where we are now with the hospitalization data in Maricopa County. Since we spoke last week, we were just beginning to see a flattening of the curve. And if you'll remember, this is the curve that we follow to show us the most accurate trends of disease in the county. People who are hospitalized have had access to testing since the beginning of this outbreak, so the trends are not as affected by the availability of testing in the community. I also want to emphasize that the data we're showing are actual data from Maricopa County hospitalizations. This is not a model. A model makes assumptions or best guesses based on the available information and can change over time when more information becomes available about the disease. This curve shows us the actual number of people hospitalized with COVID-19 on a daily basis in Maricopa County. The darker bars are not likely to change moving forward, and the lighter bars are still subject to change due to the lag in reporting data to public health. The dotted line, or the trend line, represents an average of the previous 12 days of case counts. It helps us see the slope of the line, or the slope of the curve, since data tends to bounce up and down daily as case counts change and makes it easier to interpret where we are on the overall curve. So when I look at the slope of this line, you can see that it's basically been flat for almost an entire week, beginning in the first week of April. So this is great news, but it doesn't mean we can relax our social distancing measures yet. This level of hospitalization could go on for up to several weeks before it begins to decline. And once it begins to decline, that's when we can start to talk about the best way to pull back on our social distancing, which we know needs to be gradual or stepwise. So next I want to review what we know about the chronic illnesses that we're seeing in COVID-19 cases in Maricopa County, and also the illnesses that we're seeing in people who are hospitalized in the county. What you can see is that hypertension or high blood pressure is by far the most common chronic medical condition in cases and also in those who are hospitalized. And you can see that about 1/3 of people who are hospitalized with COVID-19 have high blood pressure. This is followed by diabetes, where 1 in 4 hospitalized patients report this condition, and by cardiac disease or heart disease reported by 1 in 5 patients. These data are consistent with the data reported from China and other countries, showing that these are the top conditions reported by those who have severe disease with COVID-19, and is a reminder to us all that if you have one of these fairly common conditions, you are at higher risk for experiencing a severe outcome from COVID-19. Lastly, I want to briefly review the zip code data for Maricopa County that was released by the state. If you look at this map of Maricopa County by zip code, you see a lot of dark red with just occasional lighter areas. What this tells us is that there are positive cases in every single zip code except for one. And with the lack of testing availability in the community, I can assure you that there are people even in that zip code with COVID-19. It is also important to note that if the zip code of the case's residence is missing, the protocol is to use the zip code of the hospital. And that explains why you tend to see more cases in zip codes that have major hospitals. Additionally, residents of long-term care facilities who we know are at higher risk of getting the disease and having severe outcomes of the disease will all have the same zip code and will cluster in a particular area. So whether you see 5 cases or 50 cases in your zip code, we know that COVID-19 is circulating in the community, and you need to take the same precautions to prevent illness. Stay home as much as you can, stay 6 feet away from others outside your home, and wash your hands routinely. And please, check in on seniors and those with chronic medical conditions to see if they need any additional support. Thank you, and I will take any questions.
Thanks so much, Dr. Sonnenschein. Do we have somebody on the line for a question?
We have a question from Mark Phillips. Mark, your microphone is live.
Mark, can you hear us?
Okay, it looks like we'll move on to Ann Raymond. Ann Raymond, your microphone is live. Ann?
Ann, do you have your phone muted or your line muted?
It does look like she has it self-muted.
Can you hear me?
Yes, we
Yeah,
can.
we can.
Hi. Could you talk a bit about the increase that you're seeing with nursing homes, and then talk about anything that you're doing specifically differently other than what you announced last week with them getting priorities on the PPE?
Certainly. There's a lot of interest in long-term care facilities today, and Dr. Sonnenschein will take those questions.
Thank you for that question. What we know is that residents of long-term care facilities are the most vulnerable patients in our entire community. And that's why we are really reaching out, and we have multiple systems in place to make sure that we identify any cases or spread in long-term care facilities as quickly as possible. So we have a surveillance system where we reach out to them weekly to find out how many patients they have that have respiratory illness, or residents, with respiratory illness, and also those diagnosed with COVID-19. So as soon as they experience residents with respiratory illness, we work closely with them to get those individuals tested, and then we make sure that they implement numerous infection control strategies, including having residents dine in their room, avoid group activities, and make sure they're adhering to all of the other recommendations or requirements in the executive order to limit visitors and to check everyone for symptoms and fever before they enter the facility. So we do all of those things in addition to making sure that they have enough personal protective equipment to put every single resident in isolation precautions when there's even one case in the facility. Unfortunately, because of the group setting that these individuals live in, we now have 32 long-term care facilities that have a resident with COVID-19, and we're continuing to work with them to make sure that we're not seeing any additional spread. It's important, however, to focus on making sure that these facilities are comfortable reaching out and working with public health so that they continue to share when they have suspect cases, so we can make sure they have everything they need to protect these vulnerable residents.
Thank you, Dr. Sonnenschein. Do we have another question?
Yes, we have a question from Matt Galka. Matt, your microphone is live.
All right, can you hear me?
We can, Matthew.
All right, great. To follow up on that long-term care facility question, you said you have a number of confirmed positives at a number of facilities. Is that information public? Should it be public? Shouldn't the other residents know? Should other people know if their loved ones in those care facilities are potentially at risk?
That's a good question. Dr. Sonnenschein will answer that and how this is handled by public health.
So as part of the process of reaching out to the long-term care facilities, in addition to sharing all the infection control recommendations, making sure they have testing and personal protective equipment, we do provide them with templates of letters to send to their residents families, and even to patients who have been discharged from their facility to let them know of potential exposures. And it's important that these facilities reach out to their residents and their families to let them know what is happening. However, it's also important that facilities are comfortable working directly with public health and freely reporting when they have suspect cases. And that is why we are not personally or as an agency going to release the names of these facilities, because they need to know that when they report to us that we will do everything we can to support them, rather than sharing the information with others, which in the end may actually detract from the care of the residents. So we are relying on the facilities to share this information and giving them all the tools so that they can give the best information to residents and families.
Thank you for the question, Matthew. Do you have another question?
Yes, Mark Phillips has a question. Mark, your microphone is live.
Mark, can you hear us? We're still not hearing you.
Okay, looks like we'll move on to Peter Samori. Peter, your microphone is live.
Hey, Peter.
Yeah. Hi, good afternoon. So following up on the long-term care facilities, what type of data specifically are they reporting based on the governor's mandate for data reporting? Does that include names and numbers of residents in these long-term care facilities that have to go to the patients? Because if this is already supposed to be public data, why couldn't it not be shared publicly? Or is it supposed to be public data about specific hospitals or long-term care facilities, or I'm guessing patient names will not be revealed. But what exactly can be revealed from these places based on the governor's executive order?
So what kind of data? You know, there's a large amount of data that's being collected right now, and a large amount of data that is being shared. What has been reported so far is data that we have publicly shared about the number of cases in these facilities, as well as the number of deaths in these facilities. So I'll let Dr. Sonnenschein expand on that just a little bit.
What is required to be reported to public health and through the governor's order is different than the data that is meant to be publicly released. And what we can say is we are sharing publicly the aggregate number of the total number of cases in long-term care facilities, the percentage of those individuals that are hospitalized, and the percentage that do die. And we're able to do that because we can share that data without identifying an individual resident. And because of confidentiality laws, we are unable to release individual names of any person with any type of medical condition, and that information is protected by the law. But we can release information in aggregate, and we've released everything we can on a daily basis in our report on maricopa.gov/coronavirus.
Thank you for the question, Peter. Do we have another question?
Yes, we have another question from Matt Galka. Matt, your microphone is live now.
All right, and this is just a follow-up for Dr. Sunshine there, about something she said early on about how we've seen some stabilization, but she said it could go on for several weeks and we can't let up. So with that, am I right to assume that you don't think this, as some would say, magical deadline of April 30th, that is not that is not by any means set in stone? Should we be thinking that things will ease up by then, or do we have a long way to go?
Dr. Sunshine will take that question.
In reference to the question about a sort of magical deadline of April 30th, that is something that is being reported by modeling, which again, modeling is based on available information and the best guesses of the prediction of the future. And that's really what they are, our best guesses. But what that particular date refers to is when they are estimating the peak of the number of cases and the number of hospitalizations will be in the community. It's possible that because our social distancing measures were so effective that we may have already reached close to the peak, and that we're actually going to see more of a plateau, which is a flattening of that peak. And because it's flatter, it may go on for a longer period of time before it slopes back down again. So that date was the date that we were going to reach the maximum, and we've known all along that you can't pull back on these measures until well after you've reached the maximum. And you do have to do it in a gradual fashion, because if you pull back too quickly, then you risk having a second peak or a resurgence of cases.
Thank you, Matt, for the question. Chad, do we have another questioner out there?
Yeah, we have a follow-up question from Peter Samori.
Hey, Peter.
Hello again, Fields and Dr. Sunshine. Thank you. Following up also, how are the long-term facilities cooperating with the county on the data they're sharing?
So the question is, how are they cooperating specifically to long-term care facilities? We know hospitals are also reporting data, not only to Maricopa County, but to the state as well. So Dr. Sunshine can answer that.
What I can tell you is that long-term care facilities have been incredibly collaborative and interactive with public health, because we're reaching out to them one-on-one when they have even suspect cases of COVID-19. We're walking through not just what the recommendations are, but what their particular situation is. Whether their group dining is in a facility where they can afford to move dining into the rooms, going through individual circumstances. And because we develop those relationships with the facilities, we've had incredible cooperation with them. And that's why it's so important to maintain that trust between the facilities and public health, so that we can provide as much protection for the most vulnerable residents that we can.
Thank you, Peter, for the question. Do we have another question?
There are no pending questions, Fields.
Mark Phillips has not been able to reconnect.
I'm chatting with him behind the scenes. We do have a couple more hands raised, though.
Okay.
If you want another question, we have Ben Giles. Ben, your microphone is live.
Go ahead, Ben. Is Ben self-muted?
I've unmuted, and we'll move on to a follow-up by Ann Ryman. Ann, your microphone is self-muted. Can you unmute it for us? There we go.
Yes. A follow-up question on the long-term care facilities. At what point are they supposed to notify their residents or their employees? We've heard from some employees that, they find out kind of after the fact and when it's well known already. I'm curious what is there guidance you're giving to them, or are they required to notify other employees at a facility that there's been a confirmed COVID case?
So the question is there a timeline or any sort of law in place or requirement in place for them to notify their employees or residents of the facility of a COVID case in that facility? Dr. Sonnenschein will expand on that.
When we hear from a long-term care facility, either are notified of a positive case in that facility, or when we hear back from them that there are individuals with respiratory illness, we reach out to them, and in addition to all the recommendations, we provide those templates for letters that I mentioned earlier. At that point, we make a strong recommendation that they notify not only the residents, but also the families. But it's important for families to be empowered and reach out to the long-term care facility and ask, have you had any cases in your facility, or do you have any cases, particularly if they want to take their resident out of the facility? It's important for them to know. And then one of the other ways that families or staff can be aware of what's happening in the facility is once all of the residents are put on isolation precautions, whether or not they have respiratory symptoms, that is a sign that there has been some indication of a case in the facility. So when everybody is put on isolation precautions, that can be a clue to everyone in case it wasn't fully communicated that there was likely a case in that facility.
Thank you, Ann, for that question. Chad, do we have another reporter on the line?
We have a follow-up from Peter Smorey, and then we're going to give Mark another try after that.
Okay. Go ahead, Peter.
Well, actually, my questions have been answered, thank you, but maybe perhaps to the moderator, maybe if there's a way somebody can get a question into you via chat message, maybe that'll help if we're having some technical difficulties. But I want to thank the county for making these webinars available to all of us. It makes our lives a whole lot easier, and we definitely appreciate the access for these meetings.
We're happy to do it. So thank you so much, Peter, for the nice compliments during this stressful time. So I know you guys are really busy, and we're really busy here too, and public health has a lot going on. Dr. Sonnenschein and the other leaders here at the Unified Command, they're happy to make themselves available, but certainly they have the job of public health to do as well, and we certainly count on Dr. Sonnenschein's expertise for much of the work that's being done right now. So with that, Chad, do we have any other questions?
Yes, Mark Phillips should be on the line now.
Okay, hi, it's Mark. Sorry I've been such a problem. To the doctor,
No problem at all, Mark.
Can she confirm whether or not that 6 people who were in these long-term care facilities passed in the last 24 hours because of COVID? And then my question is, are you hearing from families that they're not getting the answers they want in a timely enough manner from these care facilities as to the extent of the COVID virus in those facilities?
So so Mark, let me rephrase your question and make sure I understand it completely. You want to know if out of the deaths that we had since yesterday, if all of those were in long-term care facilities, and also, and I believe the numbers should reflect that if that's the case. Sorry, I don't have the numbers memorized right now. Also, if we are hearing from families directly who are displeased with the type of notification they're getting from long-term care facilities. Am I getting that right?
Yes.
Okay.
Yes.
And Dr. Sonnenschein will take that, try to answer that question as best you can.
So regarding families reporting issues with long-term care facilities, we have been in communication with the AARP, who works directly with seniors and others. And we have been working with them to help share messaging with families of residents in long-term care facilities and those residents to empower them to ask the right questions so that they have the most information about the facility that their loved one is in. When we did talk to them, we asked if they had been hearing about specific facilities that haven't fully shared information with residents or their families, and they indicated that they have actually not been hearing complaints from families. But of course, we want to make sure that we continue as much open communication as possible and that families have the tools that they need to get the information to make good choices for their loved ones. So the number of deaths is indicated on our website that is associated with long-term care facilities. I can't confirm right now whether 6 occurred in the last 24 hours, but you can go ahead and look at the website, and that will show the total number of deaths that have occurred in long-term care facility residents. And I think it's worth mentioning that if you look at the percentage of the total number of cases in long-term care facilities who have died, it's much higher than our other risk groups, including those who are over 65 and who have chronic medical conditions. And that is how we know that these are the people who are most vulnerable to severe disease and why we're really putting our efforts focusing on keeping them safe.
All right, thank you for that, those questions, Mark. I hope we answered those. And Chad, do we have anybody else?
Peter does have a follow-up question.
Okay, go ahead, Peter.
Peter, your microphone's still muted. There we go, you're
Okay.
live.
Here we go. No, for some reason, my hand on the software keeps going up and down on its own, but I have no follow-up questions at this point. Thank you.
All right, thank you, Peter. Some webinar ghosts out there. All right, do we have anybody else, Chad?
There is not.
All right. Well, with that, I'd like to thank everybody for joining us for the news conference today on Wednesday, April 15th, tax day but not tax day. A reminder to everybody, we're pushing out some messages about the census. The census is not over. It's very easy to do. I did it last weekend. Please take some time. If you're stuck at home, get on your computer and spend 10 minutes answering those easy questions for the census. So with that, we thank you for being here. We'll certainly send out another advisory. We have more to communicate about how the county and county departments are working together during this time of the pandemic. Thank you very much.